Today marks 5 years since the first COVID-19 case was confirmed in Greene County. Welcome back for our COVID-19 series, looking back from 5 years ago. I'm Bailey Stroll at the Ozarks First digital desk with co-anchor Mike Landis.
Yeah, Bailey, it's kind of interesting. We had this first conversation yesterday, and we were mentioning how it does not seem like it's been 5 years ago, but it was almost like a trip back to another lifetime, because it seemed like that might have been 25 years ago, because we got through that. It was very difficult, and it seems like it was so far away because we've gotten back on track, and life is a lot different now since then.
It definitely is different, and we are not using hardly any of the same language we used back then. I mean, life is completely different, and we, as looking back, it's kind of, you got to go to the very, very depths of your brain, because I think I kind of blocked some of this stuff out, or you were just, all the days kind of jumbled together when you're going from work to home, and there's nothing else to do.
Yeah.
So today is an historic day for the Ozarks specifically, because it was the first time we had a case in our community. Of course, it was due to travel. But before then, we talked yesterday about how we were just kind of watching and waiting, and it wasn't a if, but a when. And today was that day.
Yeah.
Do you remember what you were doing on that day, if you think back?
Of the first Greene County case?
It was on a Thursday.
Yeah, I remember specifically, and I was talking yesterday, COVID happened when I was in my break between news stations, and so I was working in city government. And I remember we were, watching the cases. We'd seen the national headlines about, I think, the first case on the West Coast. And then, not like it was, people were taking it lightly, but it was almost like, okay, it's going to stay over there.
Yeah.
And then
hit the big cities, maybe.
Yeah, exactly. And then when it hit Missouri, the first case, it was almost like, oh my goodness, and surely it'll never happen in Greene County. We're too small down here compared to like New York City or LA. So I remember sitting in my office there at the city hall and getting the email stating the first Greene County case, and I was like, there's no way. But even then, surely it's just going to be the one case. I mean, this
we'll
thing
just
can't blow up,
And it's not going to spread that easily.
Yeah,
and it did.
Exactly. So I remember taking that email and showing the city administrator saying, hey, we've got this Greene County case. And even then, it was just sort of an issue of, well, we'll keep an eye on this. And things very quickly spread throughout.
And one thing I didn't remember from this day 5 years ago was this was actually only the second case, confirmed case in Missouri.
Here in Greene
County. The first case, was on the 7th, I think, and then we thought, okay, Kansas City, St. Louis, maybe they'll pop up some more cases, and nope, second case was here in Greene County, and I didn't know, but it was from somebody we know now. It was from somebody who traveled to Austria recently, and I think there was the spread that they had went to the Bruno's Cafe. Italian downtown, and so that was the first business that was like, hey, they had been there. If you had been there at this time between these dates at this,
had a press conference even. I mean, they called the whole conference on all the law enforcement and health officials, and it was a big deal downtown. Who knew that would just be the start of what it was? And we were talking yesterday about how COVID really brought into perspective how small the world really is, and how much contact you have with people, because there were these cases in China, and it really quickly got to the West Coast just from people traveling. And then so people, from here traveled to another city where somebody from another city is passing them. And then even here, I mean, how things were contagious. You never know who was carrying it or whatnot. And the health department in the initial days, it was doing the contact tracing.
Yes.
And if you had COVID, they would, who have you come in contact with, where were you were? But after a few weeks, it just got to be too much, and they were just like, there's no way to track it. And just, I believe at one point they said, we just realized that maybe not most people, but so many people are going to have it, there's no way. At that point, it didn't even matter because so many people had it.
Yeah, contact trace. That's one word that we didn't, or one phrase that we didn't use until later. And we'll talk about this later. We have a list of some of the words that we've used during that time, and contact trace is one that I missed. So there it is, popping up again. It just
came out of my archives.
Yeah, you're
there.
coming back with the vocabulary.
Back,
And funny you mentioned we had a bunch of officials here. We had that press conference. I do have some sound bites from that day we can play for you.
Contact with anyone at risk from this patient, and if there is risk to the general public, we will make public announcements as such.
As of today, 73 people have been tested for COVID-19 in the state of Missouri. 71 people have tested negative. Only 2 people have tested positive. Both of these are travel-related cases. So far,
and he goes on to say, so far there's been 2 cases, and one of them is in Greene County. But you heard our health director at the time, Clay Goddard, there say, we are going to contact every person that might be been in contact with this person. And just like you were saying, that kind of went out the window very quickly.
Yeah.
And, I mean, the governor was down here on this day, and the state health director, too, just to share this news. So looking back on it, we are realizing how big of a deal that really was. I was actually not at work that day.
Oh, okay.
I was getting married that day.
Oh, my gosh.
Just so happens that I went to the courthouse with my husband on March 12th, 2020, and I wasn't at work, and it was really hard for me because I was waiting for this day. And as a reporter, I wanted to be there when we had the first case in Greene County. And again, we had waited 5 days since the first case in Missouri, and so I thought maybe we had a little bit more time.
Oh boy.
And then, of course, I'm gone on that day, and that's when the case came. And I was selfishly upset by that because I wanted to be the reporter that was there.
Well,
you know,
yeah.
But
well, and I wouldn't say that's selfish. I mean, we're all entitled to wanting to have our life and encounter, things. And
you want to share the important information when it's there. Yeah, it was just one of those things where I started here, like I said yesterday, on January 1st, 2020, started hearing the rumblings about COVID. And we had talked about getting married soon, but I think the real indicator for me was when this stuff started to happen. I think toward the end of February, I just called the courthouse and I said, let's just get it done.
Yeah.
Because we don't know when his family's from Mexico. We don't know when we're going to be able to see them again. Yeah. And when we'll be able to see any of our family again. So he said, let's just do it. We'll have a party later. We never end up doing that. But we were at the courthouse, and again, his family was in from Mexico. And I remember the main thing was we didn't know if they were going to get home, because we didn't know if they were going to shut down the border between Thursday and Monday when they were flying out. Yeah. And that was another thing that happened in the days following this, if not on the 12th, was the U.S. Stopped accepting European travelers.
Coming in,
So that was top of mind for us.
And it's interesting because you're talking about the traveling aspect of it. At first, it was just travelers. That's obviously how it got from overseas to here. But you heard the governor in the press conference right there mentioning, these were both travel cases. And so this was so new and it was spreading so rapidly. There was so much unknown. How do we get it? How does it transfer? And there was some initial thought in the beginning that, as long as you weren't the one traveling around the world and exposed to it, and you were just here isolated in your little community, that your risk of that wasn't very high. And that might have been the case in the early days, but once again, the people that brought it over here, everybody had it before you even knew it. It just was that quick.
Yep, and I remember the anxiety of if you were to come down with a little cold at the time or the flu at the time. There wasn't widespread testing where you could go to the doctor or drive through or go to a pharmacy. You just didn't know. And now you hear a lot of people, like, once this is out, saying, I probably had it. I probably had it back in January, but I didn't know, And who knows if that's true. But that was a lot of the stories people were telling, where they had it before tests were even developed for this.
And I think it's easy to think that because, you might not have known that you had it when you did, but we've since, those of us that have it, I've had it 3 times, you know what the symptoms are, you know what it feels like, and so you can look back and be like, that's how I felt that one time, so it probably was COVID because we have something to compare it to, whereas before we were just sicker than a dog,
Yes, no, and I remember I was at work too when I started feeling sick. I was actually reporting on a testing site.
Oh my
gosh. I mean, this is way later during the pandemic, but I was at a testing site that day, and I felt okay. Didn't think I should go get tested myself. I was interviewing people that were getting tested. And I got to the live shot part around 6 p.m. and I got chills. I was outside. I was not feeling well. And then the next day I had to go buy one of those $40, I don't even know what they're called, tests at a pharmacy. And gosh darn it, it was positive. Yeah, and then I think that's when it spread through the newsroom too for a little bit.
Yeah, it's funny because during that time period, every little thing you had. Obviously, you were feeling sick, but I can recall, I deal with allergies. And so every day when I'd have a sniffle or a tickle, is this it? Oh my gosh, is this it? And most of the time it was. And like I said, I've had it before, but that was always in the back of all of our minds, I think, wondering every little thing that we encountered, is this the day for me? Yeah.
And thinking about it now, one good thing that came out of all of this tragedy was more importance on staying home if you're sick, where especially in the news, if you want to call in sick, they're going to be like, you're not a team player.
Right.
Now it's like, if you're sick, stay home. Nobody wants it, because everybody knows now how quickly stuff can spread.
Yeah.
And it's one thing that we've come out of this is like, don't even try. And and managers, I feel, are more open to, oh, you're sick? No, that's okay.
Right.
That's okay.
Yeah, before, it seemed like, for all the years of my life, not coming into work was a sign of weakness.
Yeah.
Hey, just take some Excedrin, some orange juice, and get in here. You tough it out. But now it's more of an issue of respect, because you don't mean to give something, but things do travel around, and so
it's respecting your coworkers to not spread it.
Yeah, and even knowing that I feel okay, I could technically get in there and do my job. You don't want to give it to your coworkers.
Absolutely. Oh, yeah. There are other things that happened on the 12th, of course, across the country and across the world, other than just what was happening here in the Ozarks. The United States surpassed 1,000 cases on March 12th, 2020. And I'm sure all of us can remember when Tom Hanks came out and said he had it with his wife. That was announced today by the New York Times. He was in Australia filming Elvis movie when he got that, and I didn't realize that was on this day too. Broadway in New York announced it was going to go dark for about a month until April 13th. They also didn't realize this at the time. It was known as Black Thursday. This date is known as Black Thursday. All three major U.S. trading indexes fell 7% during early trading. It led to a 15-minute trading halt. And then at the end of the day, it closed 9% down. So Black Thursday, March 12th, 2020. And the last thing was the NCAA canceled all the championship events for that year. Before they had said, oh, there will be no spectators. Then they just canceled it altogether.
And that was, we were talking yesterday, when was the moment you realized, okay, this is going to be a major deal? I think that sporting tournament, the NCAA, when that happened, that's when I heard a lot more people starting to take it seriously or realize something was happening, because especially in the sports world, if you're a sports fanatic, you realize what a massive deal that is, and that brings in millions of dollars to the economy. And so when they're
that's
canceling,
what I was going to say, it's because money was involved.
Well, exactly,
and that's when everybody's ears kind of perk up.
Yeah, and so that's when I recall a lot more people saying, man, like, if they're altering that, if they're canceling events with that or changing that, then you know something's about to happen. And that caused some fear in some people.
Yeah. And it's funny what certain people remember, what certain people documented at that time. We had a coworker here, Ryan, who was telling us it popped up on his memories that he has a picture of a gas pump from back then of how cheap gas was. I don't remember how low it really got. Like was it close to $1?
I do recall
$1.99, I think.
It did get down below $1 for a couple of days, and I remember I was in Republic, and there was one gas station that was, I think, 98 or 99 cents. I don't think it got that low in Springfield, but it was only for a couple of days, and I remember people laughing about it, taking a picture of it.
Yeah.
Some people nowadays were like, "Oh, remember those low gas prices?" Well, it was only 99 cents for a couple of days, and that was because there was a pandemic. Nobody was going
Nobody
anywhere.
was on the road.
Yeah.
I saw something interesting from the New York Times yesterday. It was a bunch of graphs showing like carbon emissions down, gas prices down, all these things. Eating at restaurants surpassed eating groceries.
Oh, wow.
I mean, opposite. You were eating more, going to the grocery store more, going to restaurants less, and that was like in the first time in recent history that had happened. So really cool New York Times graphs that I saw yesterday.
Kind of flipping there.
Yeah, how it just dipped down, and now it was also strange to see everything has recovered. It's back to the way it was for the most part.
Yeah. I think that's we were living through the pandemic, and it was horrible, but I think that during the time we were wondering, when we get over this, will it ever be the same ever again? And that's where the term new normal, that's on the list. We're going to talk about that. Will there ever, be a new normal or even back to normal? And I would say things have gotten back to more normal than I thought they would have.
Yes.
I mean, things are changed, and there's things that we still have in our lives that are a result of that. But thankfully for most of us, we've gotten back to maybe a feeling of comfort of how things used to be.
Yeah, those are the two things I think that shock me now, is how much I didn't realize what was going on and how really traumatic it was for a lot of us just to have our lives change like that so quickly. Was the number one thing looking back, is that I didn't realize it at the time. And then also looking back is how much we've recovered as mentally and as a country, just kind of completely put it behind us, you know, so quickly. I do remember talking to my mom on the phone around probably March 10th, 11th, and we had been hearing national news, and we both were saying something like, it'll probably be 3 months or so, because they were talking about stay-at-home orders.
Right.
I'm like, okay, 30 days stay-at-home order. We'll probably be recovered 3 months from now. Then the next day I called her back, and I'm like, actually, they're saying 2 years. And that's when it also hit me. I was like, oh, we're not going to be over this in a few weeks. We're not just going to have this go away. Everybody's protecting themselves.
Yeah.
This is just going to go right away.
Yeah.
And it didn't.
It seemed like it was about, thankfully we were not held up in our houses for 2 years, but really it was about 2 years. We had wave after wave. We had times where we had to wear masks and times that, things were okay-ish, but it was a good
2 years. Yeah, looking back at our coverage, it was 2 years. And that's hard for me to wrap my head around, because I didn't believe myself when I was saying it to my mother at the time that it might actually be 2 years. And it was just, I could not even wrap my head around it. And then it happened, and it was 2 years. And it's just, I wish I could go back and tell myself then, just get used to it, because it was a hard transition for a lot of us.
Yeah, no choice in the matter.
No. And also I wanted to show what we were covering back then in March, video from our newsroom from these few weeks 5 years ago, and how we adjusted. Do you remember like the time that your workplace was telling you, did you ever work from home?
I did for a few days.
For a few days.
Yeah, we stayed. We were essential workers, being government workers.
Right,
and so there were a few days where they told us, go ahead and stay home, work for home. But then it maybe was a week tops when they were like, go ahead and come back to the office. And not everybody did. Most people did stay home, but there were a handful of us in the administration that did come back into work. So I did not experience, the weeks and weeks of staying home like a lot of people did. So it was hard. It was like I was on the outside looking into those people's lives who were at home setting up home offices and stuff, because I was coming to work every day. And for my personality, I needed that. I needed to work on a deadline. There's no way I could be doing the same things that I was doing at work, at home. And so I was glad, because getting out of that routine is what led to the Great Resignation. Right.
And people just didn't want to go back to their old jobs at that time. Their lives had changed, and they didn't want to go back.
Yeah.
So I think for me, it was very helpful to come in here every single day.
Yeah, a lot of people had a lot of extra time on their hands to think and go down mental rabbit holes, and that's not necessarily a bad thing. I mean, sometimes you need something to, shake up your life for you to realize what your priorities are, who you are, what you want to be, and so that was what that served as for a lot of people, and they had too much time to think, but it was time that a lot of people needed to kind of get some things lined out, I think.
Yeah. For the newsroom, at least, once this happened, once the first case happened and there was talk of a stay-at-home order, typically our newsroom would be packed with people. I mean, we're up in each other's faces all the time,
Much,
and we talk there's nobody that's immune from being a part of the daily teamwork. You're talking to multiple different people all the time, and you're anchoring next to somebody. And you're in close contact in the car when you're a reporter and a photographer. So that changed. We split up. They sent all the salespeople home. I went upstairs to the sales. I was one of the only people working upstairs, so that was nice. I was on my little corner, and they actually separated some anchors during the day.
I remember seeing
because
that.
they only wanted them together at times doing the show, because otherwise it was limiting the contact that they had, so that if somebody did get sick, you couldn't spread it.
And I had a window into that. I was not here experiencing that, but even though I was out of news, I was still watching the news every single day, and so I saw the impacts of reporters and your stories and what you were having to do, and single anchor shows at the time are standing on other sides of the desks, and so not knowing I would eventually be a part of this, I was looking at it every day, so I got a feel for now that I'm hearing you tell these stories about what it was like inside these four walls. I can look back on that.
And when you started in you started about a year here. You started, obviously, you've been in news before, but in about a year after, so 2021 January.
Yeah, the pandemic was still going on, and we were, back here. The shields were still up, and my memory may be incorrect, but I thought you were still upstairs, maybe.
Oh, I bet. Yeah.
And so I remember some people were still spread out, and I believe I remember the news director telling me that first week I came, I did one of the first in-person interviews for a story than we had in a couple of years. And so that shows you exactly when I came back.
It had been a year.
Yeah. And so we were able
going to interviews.
Yeah. And we had another wave or two when we had to go back to doing as many Zoom interviews as possible. And so, but that was kind of, I went through a year of it and kind of came on the tail end of it right there. But I remember how it was.
Yeah, I'm sure you're still here for one of those waves. Yeah. And I had forgotten about that they did the 6 feet in between the anchors. So one person would stand way over on one side of the desk and one would stand on the other. And I'm sure viewers could see that. And that's why.
I like standing when I'm anchoring, but hey, that's a different story.
I do too. That's true.
Yeah.
Okay, so that's what was happening in our newsroom. Obviously, a lot of disinfectant happening and a lot of masks. We went through our own kind of mask requirements, whether, and the rules are always changing. It's hard to keep up with everything. Whether, you can wear your mask when you're walking around the building, but when you sit at your desk, you don't have to. It was just, one of those things.
And with the masks even, talking about when I came, there were a lot of individuals. Obviously, we as anchors didn't wear masks on the air, but all of our, camera crews, our directors, producers, everybody was wearing masks. And so I had been here for an entire year before I realized what some people looked like. When the mask mandates came down, I was like, oh, that's what you look like.
Yeah.
It was kind of an interesting
down.
surprise.
Yeah, it is strange. You talk to these people all the time, and you literally have not seen their full face.
Yeah.
So I mentioned the Great Resignation, too. That's another one on the list that I had forgotten. I should have made a list here for our graphics to show you. But let's go through some of these. I thought it was interesting to look back at the words that we had grown accustomed to because of COVID-19 and how our language changed. I called it a COVID slang. Okay. So, number one, social distancing. Never heard of that before. But now if you say it, I feel like the first thing I think of is those stickers on the floor and the gas stations and the grocery stores
stand here,
that say,
oh my gosh,
every
that.
6 feet.
Yeah.
That's one positive too that's came out of this. Used to, when you stood in line, people would be right up behind you.
You were crammed in.
Yeah,
there.
Now not so much.
Give me my space. Yeah.
New normal. I think that was a phrase that was in the newscast every single day for 2 years. New normal. And it really was a new normal. I was okay with that term.
Yeah, we had to get used to it either way. I'm glad that's not the normal anymore, obviously.
No, we have a new normal.
Yeah, we're liking this better.
An essential worker that I, looking back, completely had forgotten about the debate of who's an essential worker and who's not. We were both essential workers at that time.
Yeah.
But people like that worked at hair salons. Where were you going to get your hair cut?
Yeah.
If you weren't an essential worker, they were supposed to not be open for business. And that's tough as a government to tell people to shut down like that and to stop their business. So
it was a big debate about it. I mean,
Huge
you had
debate.
some people saying, you don't think I'm important. A hair salon individual, somebody who cuts hair. I mean, that's something that we need.
Yeah.
I even remember some people making jokes about it when they would be online and talking about they were at home like, I'm not essential. It was kind of like a double-edged thing. They were joking about it, but still it's like, some people had to run the world, still.
And then it went from even separating people into groups even more when the vaccines started coming out.
Yes.
It's not just you were essential worker. It's, or do you work in healthcare? Maybe you can get in earlier than others. Do you work in this industry, so it was weird to kind of see the hierarchy that was made there in the medical way.
Yeah.
Stay at home. I'd never really heard a stay at home order not related to a natural disaster before that, pandemic wise. PPE, that's one that I had not thought about.
Exactly.
Personal protective equipment.
Seeing those videos we had yesterday of, especially in the hospitals, all the doctors and nurses, suited up and, the masks on. And I mean, they obviously had to take the most precautions possible, working with individuals who had cases of COVID, and they couldn't be transferring that.
Scary to be on the front lines of that and to see so much tragedy that it's a lifetime in a matter of weeks that you're seeing there in the hospital.
And for a lot of people, we were talking about that new normal, and we were discussing how we're glad the world has gotten back to some semblance of normality. But you mentioned the loss. A lot of people lost loved ones, and so their lives will never be the same again.
Right.
And so once again, it's a new kind of normal, but there's a lot of people that, they will never be the same after that.
We did a story a while back during this time at Sutherland's. They could not keep N95s.
I remember that.
Or the respirators that were being used for construction, because that's what Southern it's
the hardware and stuff.
Yeah. So everyday people were going in there and trying to buy these high-tech masks, and they could not keep them in stock. They just had models out on the shelf.
Oh my gosh, yeah.
That you couldn't take, and so it's just crazy to think about. You could not get your hand on a mask at one time. It was really difficult to find some that were medical grade, other than the cloth ones. And then for a while, they were telling us to double up.
I remember that.
I did a story on that too, doubling up on masks, which the things we did, the things we did to flatten the curve. That's another one, flattening the curve. I started saying that all the time as a reporter and had never even thought about saying that before.
Unprecedented times.
Unprecedented times for every politician that said that.
Yeah.
Rona, another one, new words being formed. Zoom fatigue. I think I had Zoom fatigue, definitely. I think actually Zoom was, when I looked up some of the most popular words from that time, Zoom was like number 2 after COVID.
And I don't think most of us even knew what Zoom was.
What a company to... find
have
success.
Stock in, maybe.
Yeah.
Have some stock in. But and it's interesting now because even here in the newsroom, we had to do the Zoom interviews for interviews.
Every day.
Still do some of those sometimes. I mean, not super often, but it's actually broadened our ability to reach people, because before, if we would try lining up a story of somebody that was far away, well, you can't meet for an in-person interview. Well, we just can't do the story. Well, now you can hop on the Zoom interview. So I feel like we're able to put together a lot more stories now, having that Zoom as a tool than we would have had before in the past.
It's true. It does. It did provide another tool in our toolkit, and it was for somebody that maybe didn't want to be out and about in the community every day as a reporter around potentially infected people reporting at testing sites and stuff. It was nice to be able to stay here all day, know that I was in a safe space and get the interviews done. But on the other side of that, it was a hard transition to go back to. Like you said, you were the first person to do the in-person interview a year later, because I had just kind of gotten into a habit, and I think my news director really had to push me to go back out into the community and go get those interviews, because it's just so easy to be like, oh, can you hop on in 15 minutes? Okay, I'll send you a link, instead of, all right, I'll see you in an hour after you're done with lunch or something, All right. In-person and virtual. It's funny to say, so are you going to be doing that one in person? I mean, same thing with the interviews. It's going to be an in-person interview, whereas before it was just an interview.
Exactly. That was
in person and virtual schooling. That's another thing.
And that was a huge thing with the schools. My boys are now adults, but they were in high school at the time, and so that was a big thing. When school was canceled, like my older boy missed his whole senior year basically, and that was hard for a lot of people. I tried to put myself in their shoes, and I can't imagine what that must have been like, not being able to go and see your friends and learn in that environment. And there was just the schools did their best, but the kids, their brains were just I think,
How
fried
can
like
you
the rest of
focus?
us.
I mean, at least I had a job to do, and we were focused on COVID here. We were trying to stay up to date just for the viewers' sake and for our sake. But when you don't need to be being bombarded with all that information, and you actually need to be learning something in school, I bet it was extremely hard to stay on task when the world is kind of crumbling around you, and you're expected to just keep going.
Yeah, adding to our list here, AMI days.
AMI days.
And that's something that now when there's snow days, okay, we'll do that today. But
COVID
before that, it was like if you had a snow day, you had a snow day, there was no school. But I'm sure a lot of kids don't like this residual effect of COVID, having these AMI days, because that means you don't get to go play in the snow all day like you did in the past. But it allows school districts to keep up with the studies, and so kids don't fall behind.
And the universities, too. We're in a big college town. What do you do when you have 20,000 kids coming back into the town in a matter of 2 weeks? They had just been out with their families at other events. How do you manage that? And reporting on that part of the way that MSU and others tackled that was pretty incredible, the way that they could get some of that stuff set up and keep people safe and have contingency plans and stuff like that. And trying to put myself in those shoes, I mean, losing out on something like your senior year of high school or, those main college days, and just not being able to be with anybody is just, it's hard to imagine. And my heart goes out to those people who just kind of lost big moments in their life due to what was going on. And they probably didn't have a lot of sympathy, because everybody is worried about themselves and not really worried about, what college kids are missing out on during their college years.
They have their own stuff.
Quiet quitting, that goes along with the Great Resignation. I'm sure there's still we're still talking about quiet quitting, but that was definitely a pandemic thing of just when you work from home, it's kind of easy to slip through the cracks, I think, or look for another job and move on with your life.
Sure.
Elbow bumps. I will be happy if I never do another elbow bump in my life.
I didn't do elbow bumps, and this is kind of poking fun of myself because I'm so tall. If I elbowed somebody, it would be in their face.
Black eye.
So I honestly didn't do. It was so weird because, especially in our business, you're used to just shaking everybody's hands, and so I don't know that I ever got used to. I would still just daily reach out and like, and sometimes people would remind you, or you'd catch yourself. But the whole elbow bump, or that was interesting. I just didn't do anything.
It made meeting people, because I'm meeting strangers every day out at interviews and stuff. It made meeting people a little strange because you can't come up and stick your hand out and introduce yourself. You just kind of have to wander over and stand awkwardly.
And that kind of gesture, you're literally saying, I don't want to touch you. Everybody understood because we were all in that same boat, but it just seemed weird because, like, right now, if you met somebody and didn't offer a handshake or something, like, well, how rude. But at the time, you felt rude for doing it, but that's what you had to do. Everybody had to do that.
And when's the last time in the last, few decades that our behavior has had to change so drastically and amongst big groups like this? It's just, it was all new. One thing we haven't ever talked about were the stimulus money. Never heard of that. Stimulus money. Community spread, a lot of talk about that, and quarantine. I don't think I've said quarantine since 2021.
Exactly.
Thinking about separating rooms and putting, giving your meal through the window like you saw on social media because you didn't want to go into somebody's room that was infected, your own family member.
Yeah. Even this is one thing that I thought of, and we don't even think about this, is the word itself, pandemic. Because before we would hear about pandemics like, the Spanish flu of 100+ years ago or something, and it was never in our everyday vocabulary. And I think it's interesting now that when we use the word pandemic, we don't even need to say the COVID pandemic. We just know. It's almost like that's become the brand word for you to say before the pandemic, and we know which pandemic we're talking about because it took over our lives.
Yeah, it is weird to think about. I remember learning that word in school growing up in the vocabulary and never really, knowing what it means, but knowing that it would never happen. Yeah. And now it happened and you use it and you don't have to say, I've had to, when I'm looking at scripts and stuff where we're talking about, and they say the pandemic, I find myself changing it to the COVID-19 pandemic.
Right.
And it was hard for me to let go of the 19 part too, because it went from coronavirus to COVID-19 to COVID to the pandemic, you know, and it was hard for me to adjust to all of that. I just always wanted to say the coronavirus pandemic or the COVID-19 pandemic.
And then with the waves, we got into the Omicron variant, and so it became a mouthful. Nothing ever rolled off the tongue correctly, but there was the changes to it.
And all of those medical words that were just being used in our regular speech: convalescent plasma, asymptomatic.
Yes.
The saliva-based test. Was it a saliva-based or was it a PCR test? You know, how do you know? And those kind of things. It's just we were all experts, you know, on everything.
Yeah. Some things were not language-based, but they were just like the nose swabs. I hope I never have to do another nose swab ever again. I can still feel that. Now, obviously, they have better ways of doing that right now, but that was
for a while very uncomfortable.
Yeah,
and so for me, I'm sticking a camera in somebody's face while they're getting their nose swab, and they were not happy about that.
Yeah, we appreciate everybody that let us tell their stories during that.
Absolutely, and getting people on the phone, like with the Zoom, it's much easier when I specifically remember doing a story about expecting mothers and what they were going to do, how they were planning their birth plan in the middle of a pandemic where hospitals are full. And it was just a lot of Zoom calls and stuff like that. But, you know, wishing I could be there in person with them and hearing their stories, but only being able to hear it through the phone. But I'm glad that people were so willing to give their opinions and talk with us throughout what was going on. Scary, scary times.
A lot of folks, for sure.
Well, that's going to wrap it up for us, I think. March 12th. Will go down in history in the Ozarks and around the world. And there is a much more to cover over the pandemic. Of course, this was when it was really beginning for us. So we'll have a lot more to talk about, too, as far as when hospitals started filling up in Springfield and what Cox and Mercy did to change their practices to keep people safe and to manage the influx. And then we heard about the vaccine rollout and those first nurses that got the vaccine, and then they opened a vaccine mass vaccination site in Springfield. So we will talk about all of that tomorrow and wrap up our coverage on what happened during this time 5 years ago. But we hope you're enjoying us kind of looking back. And if you have any thoughts for us, please let us know. What were you doing when you first heard about coronavirus? That's one thing we talked about yesterday.
We had this online yesterday, and so, you know, a lot of folks are going to be watching this, you know, at home or whatnot. But the comments, it was interesting to read everybody's comments and sharing their stories. So, we'd love to hear from you. I mean, what are some of your memories about it? What are some of your thoughts about life now post-pandemic? Just share your thoughts and memories in those comments section down below, and we'll definitely look forward to hearing what you guys have to say about looking back on this.
I'm sure there's a lot of stuff that we are also forgetting, so please remind us. And one of those comments said, it felt like, you're not wrong, Mike, it felt like 10 years ago. And it really does. Time flies, and it's interesting to look back at what we've all been through. So
all together,
we'll do it one more day tomorrow. Hope to see you back here. Thanks for joining us.
Have a great one.